All right, let's dive right in. Today, we're talking about something that can be a total game changer for people who are just constantly exhausted: IV iron therapy. It's a really powerful treatment, so let's get into it. You know that feeling? You're just always tired, constantly drained, maybe a little weak or out of breath. It's so easy to just chalk it up to a crazy schedule, right? But what if it's not just lack of sleep? What if the real culprit is actually hiding inside your own bloodstream? Well, we're going to dig into what that means and, more importantly, a really effective way to fix it. Okay, so to really get a handle on the solution, we first have to understand the problem, and that problem is something called iron deficiency anemia, or IDA for short. So what is that exactly? Well, think of iron like the essential fuel for your body's oxygen delivery service. Your body needs it to make hemoglobin. That's the key protein in your red blood cells responsible for carrying oxygen everywhere. No iron, no fuel. And without that fuel, you just can't make enough healthy red blood cells. Now, your doctor can spot this pretty clearly. They'll see your hemoglobin levels are low and your backup iron supply, what they call ferritin, has dropped below this really important number, 30. Now, the first thing most people try is super simple, something we've all heard of. You just take iron pills. It's the standard go-to approach to try and top up those iron stores. But, and this is a big but, it doesn't always work out. And this, right here, is where things get really interesting. See, those pills, they're not a magic bullet for everyone, not even close. There are some really specific reasons why that first line of defense just falls flat. And that's the exact moment your doctor might start talking about getting an IV. Yeah, for a lot of people, taking oral iron is like trying to fill a bucket that's got a hole in it. It's slow, it's frustrating, and honestly, it can really mess with your stomach. We're talking major upset. On top of that, for some people with certain medical issues, their body just can't absorb the iron from their gut in the first place, so the pills are basically useless. IV iron, though, it's a total game changer. It completely bypasses your stomach and your gut, delivering that full, powerful dose right where it needs to go, straight into your bloodstream so it can start working right away. So you're probably wondering, who is this actually for? Well, IV iron is a really powerful tool, so it's kept for these kinds of specific scenarios. For instance, if you're someone who just can't tolerate the pills, they make you feel awful. Or maybe you have a condition like IBD that literally blocks your body from absorbing iron. It's also a go-to for people with certain chronic conditions, like kidney disease or even cancer. And of course, it's used anytime there's a serious, urgent need to get those iron levels up, and get them up fast. Okay, so let's say IV iron is the right move for you. How in the world does your medical team know exactly how much to give you? Well, it's not a shot in the dark. It's actually a super precise, personalized formula. The whole process is really methodical, actually. Step 1, they get your body weight. Simple enough. Step 2, they look at your most recent blood test to see your current hemoglobin level. Then, and this is the cool part, they plug both of those numbers into a special medical formula, and that formula spits out your total iron deficit. That's the exact amount of iron your body needs, not just to fix the immediate problem, but to totally restock your emergency supply. Let's put some real numbers on this. Say we have a patient who weighs 65 kilograms and their hemoglobin is pretty low, down at 8. The formula might tell the doctors they need, say, around 10 little vials of one type of iron, or maybe 9 of another type. It gets that specific. And that one calculation, it pretty much maps out their entire treatment plan from start to finish. All right, so we've got the dose figured out, but how do they actually get it into you? See, it's not just about what they give you, it's about how they give it. And the most important word in this whole process is safely. Yeah, this isn't a quick in and out kind of thing. The iron is given as a slow, steady drip, an infusion. And there's a huge reason for that. It's all about safety. If they tried to push a big dose in too fast, it could cause some nasty side effects, like making your blood pressure drop. So that slow, controlled drip gives your body plenty of time to take in the iron without getting totally overwhelmed. And how long you're sitting there is tied directly to the size of the dose you're getting. So a really small dose, maybe under 200 milligrams, might be done in just 15 minutes. But if you need a bigger dose, like 500 milligrams, you're going to be there for a while, maybe up to 4 hours. It's all about that slow and steady, safe approach. So that total amount of iron you need, you're not getting that all in one go. No way. They almost always break it down into smaller, more manageable sessions. So a typical schedule might look something like getting 200 milligrams 2 or 3 times a week, or maybe it's 300 milligrams just once a week. And you just keep going like that until you've received the full amount you need. Okay, this leads us to something that's probably on your mind right now. What about side effects? Or what about allergic reactions? That's a totally valid question, and medical teams have a very, very clear plan to keep you safe. Now listen to this, because it's super important and maybe a little counterintuitive. You'd think, hey, why not just give me an antihistamine beforehand to prevent a reaction? Makes sense, right? Well, actually, no. In fact, it's often the opposite of what they do. Because giving that medication can mask the very first signs of a real problem. And that's the last thing anyone wants. The medical team needs to be able to see any potential issue the second it starts, so they can jump in and handle it. So, because of that risk, giving premedication isn't the standard thing to do. It's really only even considered for patients who are at a higher risk, like someone with a history of severe asthma or lots of drug allergies. And even in those cases, they use very specific drugs, not the over-the-counter antihistamines you might be picturing. The entire protocol is designed around one thing: keeping you safe by being able to see everything clearly, right as it happens. So, after all those sessions, what's the grand total? Well, a typical full course often adds up to a big number, 1,000 milligrams. Think about that. That's a huge therapeutic dose. It's the amount needed to not only pull someone out of anemia, but to completely refill their body's iron gas tank. It's a level of replenishment that, frankly, oral pills just can't touch for many people. So, let's wrap this all up. IV iron isn't the first thing you try, but it is an incredibly effective, safe, and powerful tool when it's the right tool for the job. It's all about a personalized, precisely calculated therapy for those times when pills just aren't cutting it. Because at the end of the day, this is all about one thing: feeling better, having the energy you need to actually live your life. So, if you've been stuck in that cycle of fatigue and trying to fix anemia without any real success, maybe, just maybe, this is the next conversation you need to have with your doctor.